Now there is another MCQ. A person comes to you with an eye look outward and downward. Eye look outward and downward. Which nerve is paralyzed? Of course we know that this is cranial nerve 3. But how? Suppose this is eyeball. If the cranial nerve 3 is paralyzed, we still having two nerves, lateral rectus nerve and superior oblique nerve. Lateral rectus will move the eyeball laterally. Superior oblique will move the eyeball downward. So the eye look out and downward due to the unopposed effect of the lateral rectus and superior oblique. So the eye look outward and downward. It is a classical manifestation of cranial nerve 3. Now there is another MCQ. A patient with an eye look outward and downward with pupil dilatation. Where is the problem? That is cranial nerve 3. Another is same MCQ. An eye look outward and downward but with the normal sized pupil. Now there is a concept behind this. If you take the cranial nerve 3 and take the cross section of that nerve, you will see that the fibers controlling the size of the pupil lies in the periphery, while the motor function lies in the center. So any disease that comes from the outside will cause problem to the pupil. It will cause pupillary dilatation. And any disease which comes from the center would not affect the size of the pupil. Now what are those two diseases? From the center, diabetes mellitus, hypertension are the most common causes. So if a patient is having an eye that looks outward and downward with the normal size pupil, you should think of diabetes and hypertension, because the pupillary muscles they are relatively spared. Now if there is something coming from the top and that impinges on the nerve from outside and compress it, it will affect both the pupil and the motor fibers to the muscle. And the example for this is that tumor, any tumor compressing on third nerve. And the classic example is the supratentorial herniation. We are having the brain. This is brain, this is cortex, this is temporal lobe. So what happens when there is temporal lobe tumor, or when there is raised intracranial pressure, what will happen? That the brain herniates downward and impinges on the third nerve. Now that is the differentiating point based on just a clinical manifestation. Whether a person is having pupil dilatation, think of something inside the brain that is impinges from the outside to the inside. The patient is having normal size pupil but the eye look outward and downward, you are having classic example of diabetes mellitus and hypertension. So I think we have covered all the MCQs based on the extraocular muscles. If you are having any question regarding the extraocular muscle, you can ask in the comment section below so that I can answer.